My name is Obapeni Awojimfo. Today we are talking about schizophrenia. So this is a severe long-term mental health condition which affects a person's way of thinking, feel, and behavior. These people, they are disconnected from reality. Let's look at some of the causes of schizophrenia. The exact cause of this condition is not well known, but research suggests that some life stresses such as marriage, job search, divorce can all trigger this condition. Drug use, that is, those who are drug addicts, can also trigger this condition. Genetics, it can also be an inheritance thing that the person inherited from a family. We have the childhood trauma, that is, the person either observed a violent scene during childhood, or the person was abused during childhood, or even neglected as a child. Prenatal and obstetric complications, that is, complications during childbirth, malnutrition, and maternal infection. Urban environments can also trigger this condition. So pollution and stress factors that comes with the urban lifestyle, they all contribute to schizophrenia condition. We have the brain structure and the brain development. Brain structure in terms of the person or the patient having a smaller brain region or the brain has been altered. And then the brain development is where the person's brain was not properly developed before childbirth. So, with the symptoms, we have behavioral, we have cognitive, we have mood, we have psychological, and then we also have speech symptoms. Let's look at the behavioral. With the behavioral, you would see something like social isolation, agitation, aggression, compulsive behaviors, hostility, excitement, or even self harm. With cognitive, you see something like thought disorder, delusion, amnesia, mental confusion, or false belief of superiority. Mood symptoms, it comes off as anger, general discontent, apathy feeling, detachment from self, anxiety, or loss of interest or pleasure in activities. For speech, they have speech disorder and incoherent speech or rapid speech. For the psychological symptoms, they hallucinate. So, hallucination, paranoia, hearing of voices, depression, fear, or religious delusion. There are also other symptoms like fatigue or memory impairment. Effect, self harm. They can harm themselves because of all the anxiety and the depression and the symptoms that they are feeling can result in self harm. They also have a detached or they have a reduced feeling associate with people. So they end up losing relationships. There's a reduction of motivation to engage in activities. They reduce expression of emotions. As I said, that's why they end up losing relationships. They are likely to die early, and they may have physical disorders such as obesity, liver dysfunction, stroke, diabetes, and many others. Let's look at the treatment. Schizophrenia is not curable, but it can be treated. It can be managed, well managed, if the person adhere to the directive of his or her physician. The major treatment for such patients or people who are schizophrenic is therapy and medication. It can be cognitive behavioral therapy, family therapy, group support, rehabilitation, or psychoeducation. These are all therapies that helps schizophrenic patients. And medication is antipsychotic or anti-tremor. It depends on the condition of the person, and that will also determine the kind of therapy the physician would take him through or her through, or the medication that will be recommended. Schizophrenia can happen to anybody. In men, it usually starts in the late teens to the early 20s. That is for the symptoms. For you to know the person is having something like that, it usually starts in the late teens and ends in the early 20s. That is for men. For women, it starts in the late 20s to the early 30s. Note that early treatment for schizophrenic patients can go a long way in helping them relate well with people, work, or even school, and also be able to build personal relationships. I hope you've learned something in this episode. I'll see you some other time. Bye.